dedicated to empowering you with information
to make positive choices
and be advocates for your overall well-being.
Welcome to The Health View. Welcome to The Health View. I'm Yvonne Dunetz, and today we're going to be talking about Parkinson's disease and movement disorders. My guests today are Dr. Rebecca Thompson and Dr. Stephen Lee. They are both neurologists, and they work at Dartmouth-Hitchcock Medical Center in Lebanon, New Hampshire. Welcome. Dr. Thompson, please tell us, what is Parkinson's disease?
Parkinson's disease is a chronic progressive neurological disorder that is due to a lack of dopamine in the brain. And we don't have clear ideas about exactly what causes Parkinson's disease, but we do know that it is pretty common in the United States and also around the world, and it affects a large number of people in our community. And there's a lot of issues that go along with it, as far as mobility issues and also non-motor issues over time.
Dr. Lee, what are the symptoms of Parkinson's disease? How is it picked up?
So the strictest definition is the three critical findings about movement. Movement involves slowness of movement. That's the most important. The slowness of movement is called bradykinesia, and it may be defined with a resting tremor. That is a tremor of any part of the body when the body is at rest. And then the third one would be the rigidity, that someone experiences muscular rigidity when a neurologist examines a patient. Those are the three most important criteria that defines Parkinson's disease. But we certainly know that it involves many other signs and symptoms that are motor as well as non-motor.
And how early in age can one all of a sudden develop these symptoms? Is it something that someone can get at a young age, or does it begin in the older years of one's life? Rebecca?
It can happen at any age.
Yeah, it can happen at any age. I mean, we definitely see people with onset as young as you can be very young, you can be in your 20s, but some of the genetic causes of Parkinson's, which are definitely the less common overall types of Parkinson's, can have a younger onset, like when people are in their 30s or 40s. More on average, though, when people have the non-genetic causes, which are definitely much more common, they're idiopathic causes, meaning we don't know why they happen. That tends to be people who are at least in their 50s, more often in their 60s and 70s is probably what we see on average.
And Dr. Lee, what are the types of treatments for Parkinson's disease? Well,
in the early 1950s, we didn't have much to treat it with, but in the 1960s, the levodopa was discovered, and it was discovered that the main cause for Parkinson's disease, or the main associated feature, is a loss of dopamine in the brain. Levodopa was invented as a way to get dopamine levels in the brain to be higher, and that replaces a lot of the dopamine that's missing, resulting in effective treatment of the motor symptoms of Parkinson's.
I see. And
I hope that was clear.
Yep. And from a neurological point of view, the specialty of neurology, what does it offer in addition to a primary care provider? Does a person go to their primary care provider and then get referred to the specialty of a neurologist in order to seek treatment as well as diagnosis of this disease?
I think that a lot of times it does start with the primary care provider, and either that provider is seeing something like a change in the way that somebody is walking, or having some sort of tremors in their arms, or stiffness or slowness. And a lot of times that will spur a referral to neurology, just to sometimes confirm a diagnosis as Parkinson's. And even within neurology, there's this specialist that both Steve and I share is movement disorders, which is a specialty within neurology that focuses a lot on Parkinson's disease. And so even general neurologists will sometimes refer on to a subspecialist within neurology just because it is such a clinical diagnosis, meaning there's not necessarily a blood test that can be done to confirm the Parkinson's disease diagnosis. So sometimes you really need the opinion of someone who just sees Parkinson's disease all the time.
So tell us a little more, Dr. Lee, about movement disorders, because you're both specialized in that, and you said that's in addition to your neurological training. Perhaps you can start, and then, Rebecca, you can follow through on that.
Sure.
Well, Parkinson's disease makes up one of the larger groups of movement disorders. We treat primarily movement that is involuntary, that can be interfering and affecting someone's ability to do things. Tremor in the form of essential tremor is actually the most common movement disorder that we see, and it's treated differently than Parkinson's disease, and a lot of times the Parkinson's disease diagnosis may be confused with essential tremor. So as a subspecialty, we often are faced with trying to determine whether someone has Parkinson's or essential tremor. And there are a host of other rarer but also devastating neurological diseases such as Huntington's disease and subtypes of Parkinsonisms that aren't really Parkinson's disease but act like Parkinson's that form a range of other movement disorders. And the list goes on. Tics, for example, in Tourette's syndrome we see as well.
And
so
the
just
difference
a smattering.
The difference between Huntington's disease and Parkinson's is what?
Well, in Parkinson's disease, there's a lack of dopamine overall, and that's usually what's leading to the symptoms that a patient's having. In Huntington's disease, it's actually a purely genetic disorder where someone has a gene mutation that is causing them to have an abnormal Huntington protein, which causes progressive issues over time. So it's also a progressive neurological condition, but it tends to present on the Huntington's end of it with too many movements, extra movements, lots of cognitive changes, as opposed to Parkinson's that tends to be more of a stiff and slow lack of movement. They can also have cognitive changes, but for very different reasons.
And as far as Parkinson's disease, when a patient comes in to be seen by you, what is involved in the workup to assess their needs and to determine their diagnosis? Is it a very lengthy workup that you must do?
The most important, I think, that helps us help the patient is spending time with the patient to get to know them and to understand the story or the development, evolution of the symptoms. Because the development of these symptoms happen very slowly, insidiously over time. And many patients aren't really aware of some of these symptoms, and a set of careful questioning really brings to light some of these symptoms. The internet is full of information these days, and a lot of times the spouse or caregiver will have done some research and have checked off a lengthy list of very concerning positives to a list of things that may represent Parkinson's. So a lot of times our job is to either to confirm and verify or to find alternate explanations for what may be going on.
And what would some of those things be?
To help the patient the most, we spend time listening to what their story is, and then we spend time examining them.
In the process of examining them, a neurological workup entails what?
So a large part of the neurological workup is the exam, and that is kind of a head-to-toe exam. You know, we spend a lot of time looking at eye movements, facial features. Specifically in Parkinson's, we have maneuvers trying to elicit any sort of a tremor that might be there, doing passive movements with the limbs, looking for stiffness. Watching them walk is a major part of our exam. Doing a little bit of memory testing in the office is usually part of the exam. And then depending on what we find, a patient may also need additional imaging and sometimes blood work also.
And does Parkinson's disease run through families? If one member has it, does it mean automatically that others will get it?
So that's a mixed answer. Sometimes in rare conditions, Parkinson's disease runs in families, and it's due to certain genetic disorders. I'd say the estimates between 5 to 10% of cases may be as high as maybe genetically related. The vast majority of cases of Parkinson's disease are sporadic. That is, there's no rhyme or reason why someone would have it. There's no family history of it. And even then, sometimes there may be a family history, but it's just not discovered. So a lot of information that may be genetic goes under the radar, where we're not able to detect it yet, simply because our genetic powers and genetic diagnosis is not fully developed yet.
And oh, go ahead. I'm sorry.
I could go on and on about genetics, but I'll just stop at that.
Okay. And I understand many years ago that there was a flu virus in Europe, and at that time, a number of people that got exposed to it and had it ended up with the flu. With Parkinson's disease, a number of which that particular generation may still be living now or may not. Are you familiar with that?
So I'm not familiar with that exact outbreak, but there are definitely viruses. There's a flavor of Parkinson's symptoms that's post-encephalitic Parkinson's, and it's usually after someone has had a virus. Often, though, they've been in, they've had an altered mental status with that. It's been a really not just your average flu type thing, but there is such a thing as having a post-viral Parkinson-like syndrome. Usually, though, that is, even though they have Parkinson's symptoms, so we would call it Parkinsonism, it's not the same process as the idiopathic run-of-the-mill Parkinson's, where someone's having this gradual loss of dopamine cells over time.
And the treatment, I know, Dr. Lee, you began to talk about that related to dopamine, but what is the prognosis for someone with Parkinson's disease and the development of the disease over time, as well as the treatment for it?
Sure. The treatment is geared towards the patient at many levels. The most important is to get them moving get the patient moving as much as possible back to the way they were, and that primarily is a requirement of restoration of the levels of dopamine. There are other circuits in the brain that are altered that may lead to imbalances of other brain chemicals, leading to anxiety, depression, other features such as apathy, cognitive problems with attention that are part of the problem and don't really surface until we get part of the tremor taken care of, and other complaints may surface, or it may be the primary complaint. I remember several patients who really had anxiety as a major problem, and those conditions were extremely hard to treat and treated differently with other medications or with psychotherapy. And we take a holistic approach as well, thinking about other modalities, wellness, alternate medicine. So it's not just throwing medications at every symptom, which is something that is something we feel that we're not limited to, and certainly not something that we would desire in any comprehensive treatment plan. So it really takes some time to develop a treatment plan that encompasses many different levels of therapy.
And Dr. Rebecca Thompson, as far as when a person from the time they're diagnosed, the prognosis over a lifespan, will they die of Parkinson's disease and the process of it being perhaps mild at one level, do they go to the more progressive and then severe, or can someone stay at one level for many years of their lives?
I always like to tell patients that they will die with Parkinson's disease, not necessarily from Parkinson's disease. It's usually something, in a lot of cases, that can be managed pretty long term, as long as the patient is healthy in other areas of their life. Like Steve alluded to, one of the most important things for these patients is exercise. The medications that we have just kind of cover up symptoms. They don't prevent disease progression. So that's really important. We don't have any medications that at this time that reliably slow the progression of the disease. And so we're always on our patients to exercise, because there have been some studies showing that exercise might slow the progression of the disease over time. And then it's hard because the patients all are so unique and they all present so differently. There are definitely patients who go decades with very little progression and are able to stay on very low amounts of medication. And then there are other patients who we don't know why, but they seem to progress a little bit quicker and have more mobility issues and things like that. We do have a staging process where, and it has to do, as you move on from stage 1 to stage 4, the main thing that is changing is, as you get to stages 3 and 4, is issues with your mobility, and that's usually what starts to affect the quality of life and independence and things like that. But we don't have great predictors on which patients are going to progress faster than others.
And as far as physical exercise, where you mentioned that movement is important, is there any one in particular that helps someone with Parkinson's that they should focus on, that would help their body stay limber and be able to move and help with the stiffness?
So that's a great question, and patients have come up with many different and very creative ways of staying active, and there's no single answer for this, and every treatment is individualized. But just to give you an idea of the spectrum, we have avid cyclists who treat their symptoms with cycling. We have others who dance, and whether it's ballroom dance or modern dance. There's also Rocksteady Boxing, which is a program that recently was developed. So the programs go on, and I'm sure I'm missing a few. Tai Chi is another one. Yeah. And there's a lot of evidence based on clinical trials to show that Tai Chi, at least a selected from the book of Tai Chi, a small select subset of moves from the book of Tai Chi helps with balance, and that really helps with the motor training, so that someone's ability to handle their center of gravity when it's slightly off is a little bit better. And the same thing with dance, with syncopated rhythms, and Argentinian tango seems to be one of the better ones in a small study. So we have a lot of fun trying to come up with ways to keep patients active, and we always encourage it. And in fact, one of our residents here developed a Dance for Parkinson's program that is at our medical center every Thursday night, which is available to, unfortunately, only to patients who are within driving distance of the medical center, but we would love to expand the program to other areas as well.
That's terrific. And at your center, your medical center, do you offer other things for Parkinson's patients and other people with movement disorders?
We do. We have fairly comprehensive services available here. We have a really great physical therapy and occupational therapy program here, and one of the things that we're able to offer our patients is the Big and Loud program, which was a program designed specifically for patients with Parkinson's disease, and it's one part of it that works on their speech issues is the loud part of it through speech therapy, and then part of it that works on their movements, trying to make everything bigger through occupational therapy, is the big part of it. And we just have really great providers in that area that work with our Parkinson patients. We also have, for patients without Parkinson's disease, we also, for those patients for Huntington's and other issues, we rely heavily on our therapy colleagues. And I think that the people who do come up here to get their care, they end up with a pretty comprehensive set of providers to help with their symptoms.
So it's an integrative plan to help them through the process of because they're not, who they are is not their disease. They have a diagnosis, and you're trying to help them have the tools and information that they need and the supports that they need to live their lives in the healthiest way that is possible, and the quality of life to increase it in the best way as possible.
Right, and I think especially where a lot of the diseases that we deal with do not have cures, they just have symptomatic treatments, that it is important to kind of have a multidisciplinary approach to the care.
I would think that that would be critical, because if that wasn't offered to a patient could feel helpless or hopeless, that there was no way that they could live with their diagnosis or disease and have additional positive outcomes. This way, you're providing them information, supports, education, and tools to help them with their body as they notice the changes in their body, and to be as productive and have the best quality of life as possible, correct?
Right.
So from your point of view, why did you choose to specialize in neurology and in Parkinson's disease?
You can go over that.
I'll start. It was an interface between genetics for me. I did a PhD in genetics, and I was studying a family with inherited Parkinson's in a large Amish community. And through my involvement in that research, I also became fascinated with the ability to treat some of the symptoms of Parkinson's. So we have medications and we have other therapies that are available, and so this is a very treatable disorder, and we can make an impact on someone's well-being. So I felt that there were many different levels, both from an unknown standpoint. It's still an unknown neurodegenerative disorder that requires us to do a lot of research to really find the ultimate solution. But in the meantime, there are a lot of other things that we can do to mitigate some of the problems and symptoms.
And for you, Rebecca?
And I just studied neuroscience in college, so I was always really interested in the neurosciences as a whole. And then after I decided to go to medical school, I just always really enjoyed the neurology rotations and education that we got. And then once I got into my neurology residency, I became interested in movement disorders, particularly because I liked the patients. There's, Parkinson patients tend to have kind of a nice personality. It's hard to explain, but they're kind of a nice patient population. And we do have, like Steve was saying, some nice treatment options for them at this point, even though we are just treating symptoms, being able to see them getting some relief. And then also, deep brain stimulation is something that I have a lot of interest in, and that's something that we use for multiple movement disorders here, including Parkinson's, essential tremor, dystonia, and even some other conditions.
Talk about that a little further, the brain aspect.
The deep brain stimulator?
Yes.
Yeah, so it's a surgical procedure, and it's as far as brain surgeries go, it's a pretty minor brain surgery. Someone just has 2 small incisions and 2 small holes in their skull, and then 1 or 2, depending if you're going to do one side or both sides, a lead is inserted, and the tip of the lead has electrodes on it, and we target certain areas in the brain. The exact target in the brain might differ depending on the disease that you're treating. And so from the tip of that electrode, we can emit electrical activity that somehow disrupts the abnormal pathway that's causing the patient's symptoms. And we are able to program that device from the outside. And it's very personalized as far as we can adjust parameters like voltage and how often the pulse goes. And it can provide symptomatic relief for things like the tremor, stiffness, and slowness in Parkinson's.
And will it last a long time, or is it a temporary relief?
Well, we certainly have seen the relief or the benefit from the deep brain stimulation last for a long time. It was only put in use around 1999, so about 20 years, 20 years now of deep brain stimulation has been going on now in clinical practice. So it's interesting. There are some patients who have had this for many, many years, and they seem to be doing well. There have been some studies that really carefully looked at this, and they found that it suggested that the progression of Parkinson's still goes on despite deep brain stimulation. So we know that that deep brain stimulation is a very effective way of altering the affected circuitry that the dopamine deficit causes, but the overall neurodegeneration, the process that degrades brain cells, still proceeds at a certain rate.
Well, we've got 2 minutes to go, and how would you summarize the most important information that you'd like people to know about Parkinson's disease, symptoms to be aware of, and how they can get help for it?
I think one of the most important things they can go in with is just a positive attitude about their symptoms, and knowing that this is something, for the most part, they can live with. They can usually continue regular life. They should make exercise a priority, and they should find a good neurologist, and preferably, if they have anything complicated at all about their symptoms, they should find a movement disorder specialist to follow with.
Okay, and as far as symptoms that they should be watching for?
Any signs of slowing down, any signs of rest tremor, any type of difficulty with balance, loss of sense of smell actually is one of the early signs of many neurodegenerative diseases. There's a condition, REM, sleep behavior disorder. We didn't get to go into that, but there are many other signs. But for the most part, if there are any balance problems, any difficulty with mobility, I think that's the most important symptom to have it checked out.
And you also mentioned speech, a difference in their speech, as well as the tonation and the loudness from loud to softness, correct? Did I hear that correctly?
Yeah, they might find that their speech is getting a little bit softer, what we call hypophonia.
And for further information about Parkinson's disease, can people go online for it, or is there a particular area within your medical center that they can learn more about it?
If they search for the Dartmouth-Hitchcock Movement Disorder Center, they will fairly easily find the website for our center. Excellent. And other good resources for people with Parkinson's are the American Parkinsons Disease Association, APDA. I think that's a .org. And then the Michael J. Fox Foundation also has some good information on their website.
And the National
wonderful.
Parkinson Foundation.
National
There are many
Parkinson.
foundations.
Excellent. You have been terrific. I thank you very much for this wonderful, informative program. I thank you for joining us. Until next time.